You may have normal weight obesity and not even know it. Today's health tip, normal weight obesity could be costing you your brain. So, normal weight obesity is exactly what it sounds like. You have a person with a normal weight, you have that person at a normal BMI. These are the things that your healthcare provider generally looks at. So, if they see a normal weight, they see a normal BMI, they may tell you you're fine. But you may still have obesity. And here's an example. This is a patient of mine, and she's at 137 pounds. Her BMI is completely normal, 23.2. Yet, when I looked at her percent body fat, she was 43.7% body fat. All right, and that puts her in the obese category. Now, if you passed her on the street, you wouldn't think of her as someone with obesity because, as I said, she looks thin, she's at a normal weight, she's at a normal BMI. But when we look at percent body fat, which is a much more accurate way to assess obesity, then we see that she does have obesity with a body fat of 43.7%. Here's another patient, and she is 112.4 pounds. Again, you would consider this person skinny if you passed her on the street. Her BMI is 21.2. Her percent body fat was 38.4, which for a woman puts her in the obese category. So again, another example of normal weight obesity. Here is a man, and his weight 187.5 pounds. His BMI, you'll note, was slightly above the 25, which puts you in the overweight category. So he was 27.7. His percent body fat was 25.4%. And that put him in the obese category for a man. And again, if you saw him on the street, you wouldn't quite think of him as someone with obesity. Here's another number I want you to look at that you can find on a DEXA scan, and that is the VAT, or visceral adipose tissue. This is actually looking at the fat inside the belly, right? You can't quite see it here, but it's fat that's inside the belly. If you try to pinch it, you wouldn't be able to because it's not under the skin, it's inside the belly, and we call that visceral fat. So this is a study that showed that visceral fat or visceral adiposity is associated with lower blood flow to the brain as we age, right? And so the translation of this study, which came out in 2019, is that sick fat in the belly equals low blood flow to the brain. People with normal weight obesity generally don't know that they have obesity. And the way that you should assess it is to use the gold standards, generally CT and MRI. However, it's hard to get a CT scan or an MRI, and CT can give you radiation that you don't want to accumulate. So most people in a clinical setting will use DEXA scan, which is this machine here. It's also used for bone mineral composition if you're looking at bone density, right? So using DEXA or CT or MRI, if you are a man and you have total body fat of 25% and greater, or if you're a woman with 35% body fat and greater, that would put you in the category of having obesity. Now, sometimes people will tell me that they went to the gym and their trainer used one of those handheld bioimpedance devices to measure their body composition. Those are very, very inaccurate. And if you are a man, whatever number you got at the gym, add 10 to 15% for the body fat, right? So if it measured 5% body fat at 10, right, that would put you in about the 15% or 20% if you added 15, okay? Same for a woman, except you add a little bit more. So whatever number you got at the gym, you're going to add 20 to 25% body fat, and that is a more accurate estimation of what your true percent body fat is. Now, when you're thinking about this and you're asking questions of, do I have normal weight obesity? Here are some action steps for you to consider. Number one is get an accurate body composition measurement. And again, the best way to do this is with a DEXA scan, right? DXA scan. You want to cut out processed foods, carbohydrates, and sugars from your diet. You want to eat some healthy fats as 30% of your diet energy intake, and this would be in the form of olive oil, avocado, fatty fish, and so forth. Have any questions? Leave them for me in the comments below, and I'll try to get to them. Bye.